If you've just been diagnosed with adenomyosis, or you think you might have it, your doctor's appointment can feel overwhelming. You're trying to process the diagnosis, remember your symptoms, and ask the right questions, all at the same time. And the reality is, most people leave their appointment thinking, I forgot to ask something important. So here are the key questions you need to ask, so you leave feeling informed, not confused. Start with clarity. Ask your doctor what actually confirms adenomyosis in your case. Was it based on symptoms, imaging like an ultrasound or MRI, or something else? It's also important to ask, could this be another condition, like endometriosis or fibroids, or even a combination? And don't forget to ask how severe your adenomyosis is, because that can affect your treatment options and long-term plan. Adenomyosis symptoms can vary a lot, so it's important to understand your baseline. Ask if your level of pain, heavy bleeding, or clotting is typical for this condition. Find out which symptoms you should be tracking, like cycle length, pain intensity, or fatigue. And most importantly, ask when something becomes a red flag. At what point should you seek urgent care or follow up sooner? This is where you need real clarity. Ask about all your options, not just the first one offered. What non-surgical treatments are available? If hormonal treatments are suggested, ask if they're suitable for you specifically, and what side effects you should realistically expect. You're not just agreeing to a treatment, you're choosing something that will impact your daily life. So take the time to fully understand your options. If having children is something you're thinking about, now or in the future, this conversation is really important. Ask how adenomyosis might impact your fertility. Are there treatments that help preserve it? And should you consider seeing a fertility specialist earlier rather than later? Even if you're not planning a pregnancy right now, understanding your options can help you make more informed decisions later. Surgery isn't always the first step, but it's important to understand when it becomes an option. Ask when surgery is recommended for adenomyosis. What are your choices? Are there conservative options, or is hysterectomy being considered? And what does recovery actually look like, physically and emotionally? Most importantly, ask about your long-term plan, because managing adenomyosis is often about ongoing care, not just one decision. You are allowed to ask questions. You are allowed to take your time. And you are absolutely allowed to be heard. You deserve clear answers about your body, your symptoms, and your treatment. Save this so you feel prepared at your next appointment, and follow Adenomyosis Hub for more honest, supportive information on adenomyosis.